Welcome to Meditech. This is an introduction and brief overview of the Meditech EMR from the provider's point of view. Each computer in the hospital will have a Meditech icon on the desktop. Once you click on the icon, you will be brought to this sign-on screen. Use your network username and password to log on. You will then be brought to the Application tab. You will click on the green Meditech icon. If you are using a computer outside of the SFH network, use the web address listed, and it will take you to the main log on screen. Once you have signed into Meditech, you will be taken to the Physician Care Manager screen. Then My Notices header button will be highlighted. For this screen, you will be able to view any critical lab results, abnormal radiology results, documents that need to be signed, and messages from other providers. The Sign button on the right will be in red when there are reports to be signed. Click on this button to go through the sign routine. From the Side tab, if you click on Patient List, you'll be brought to this screen in which you can select the patient list that you want. The first header button, My Patients, will bring up any patients in which you are the attending, admitting PCP, or if you have signed up for a patient. The second button, Rounds Patients, shows any patients assigned to your provider group. The My Discharged button shows any patient assigned to you that has been discharged. The Cover Discharged button will not be used until Phase 2. Click to left of the patient's name in the Open Chart column to open the patient's chart. If there are new results for the patient, the chart will automatically open to the New Results tab. By clicking on individual items in the result diagram, you will be able to see its details. A result that is highlighted in pink indicates a critical result. An H indicates a high result, and an L indicates a low result. A text bubble shows that there are additional comments attached to this result. Below the lab results is the exam report box. By clicking on the report icon, you will be able to view the report or image. If there are no new results, you'll be taken to the Summary tab, Clinical screen. For this tab, you can view the patient's diagnoses, allergies, active medications, and immunizations given. Any current medical or procedure reports may be accessed through this screen. By clicking on the blue Edit button in any section will allow you to add or edit information. At the top of the screen, you will see a header that displays patient information such as name, birth date, location, resuscitation status, height and weight, allergies, and visit number. By clicking on the blue eye icon, you can see more details on the patient. The Summary tab, Legal Indicator screen, shows the patient's DNR, isolation, IV, and smoking status. Any precautions may be flagged. Summary tab, Demographic screen, lists all patient demographic information, including contact information and insurance plans. By clicking on the Vital Signs tab, you are able to view the patient's vital signs. Anything highlighted in yellow indicates that a result is outside of the normal range and is indicated by an H for high and L for low. You also have the option to graph the vitals by using one of the footer buttons. By clicking on the I and O tab, you will be able to view the patient's intake and output. Currently, the data is shown over a 24-hour time frame. At the bottom of the screen, you will see multiple footer buttons that give you the option to view the patient's I and O over 1, 4, 8, and 12-hour intervals. You also have the option to graph this data by clicking on the Graph footer button. Within the Medication tab and Medication List header button, you will be able to view the medications for your patient. The footer buttons at the bottom of the screen give you the option to see either active medications, discontinued medications, or all medications for that patient. The drug class filter button allows for a faster search. The MAR header button allows you to view the EMAR for the patient. At the top of the screen, you will see boxes labeled active, Stat 1, IVs, PRNs, pending, and discontinued. By checking any of these boxes, you will be able to see medications with that status. The Laboratory tab will bring you to Lab Results. The header buttons will allow you to filter by selected visits or all visits. By clicking on Hematology or Toxicology, you will be able to view any results in that category. Other categories may appear depending on what lab results are available. Once again, you notice that both high and low results are highlighted. The Reports tab will bring up radiology reports and dictated reports, including history and physical consults and discharges. If you click on the clipboard icon, you will be able to view the signed report. The Patient Care tab displays all patient assessments, interventions, outcomes, care plans, histories, scan forms, and surgical assessments. You may filter by date, name, recorded by, and provider type. From the Notes tab, you may view all notes or select a specific category to view. To view an individual note, check inside the box next to the note and click the footer button, View Selected. You can use the View Selected Dates footer button to filter the entries by date. The Sign tab will be highlighted in red if there is anything to be signed. To sign a document, check the box next to the document and click the View and Sign footer button. Your document will appear on the screen. The footer buttons on the bottom of the screen will allow you to either sign the document as it appears, or you may edit the document as needed. Thank you for completing the Meditech EMR Provider Overview. This tutorial is available on the St. Francis Hospital intranet.